In occasione del Genito Urinary Cancer Symposium dell'ASCO in corso a San Francisco, il professor Gregory ha presentato un nuovo modello basato su 6 fattori clinici per predire la sopravvivenza generale in pazienti con carcinoma uroteliale avanzato trattati con atezolizumab. E noi ci facciamo spiegare di che cosa si tratta. Allora, professore, che cos'è questo modello?
So the model that we developed basically uses 6 common factors and laboratory variables to identify those patients who are at most increased risk for, at high risk or at medium risk or at low risk for overall survival amongst this patient population. So we used a couple previously published clinical trial data sets to develop and then validate our model. So the first data set that we used was called the IMvigor 210 clinical trial. And that was a phase 2 single-arm study. And we used that data set to create our model. What we did, we developed a 6-factor model, and then we identified those risk factors. For each of those factors, what considered a risk factor for each individual patient. And then based on the number of risk factors, we estimated what their overall survival would be. We then validated it in the second data set, which was the PCD 4989 study, which was a phase 1 study of 95 patients. And ultimately what we found was those patients who had 0 or 1 risk factors had fairly good overall survival, with a median survival of almost 20 months. The rationale is that in the past couple of years, there's been a breakthrough in urothelial cancer. So there's been 5 new checkpoint inhibitors that have been approved by the US FDA. Now, while this is a tremendous breakthrough, we're not sure which patients are actually going to benefit and which ones are not going to benefit, nor do we know which of those checkpoint inhibitors should we actually give to which particular patients. So the rationale for our study is to try to find out which patients would most benefit from which individual, from which checkpoint inhibitor. And in this case, we looked at atezolizumab. In the development data set, which was the IMvigor data set, the first thing we did was we used Cox regression models to identify those factors which were prognostic. And then we used a statistical technique called stepwise selection to identify an optimal model. And that's basically looking at which factors combined with each other produce the best outcomes in terms of the model. That's how we came up with the 6 different variables. And then based on those 6 factors, we identified risks. So what are the key risks for each of those 6 factors? And that was all performed within the development data set, or the training data set of the IMvigor data set. From that, we then looked at we took that risk stratification and applied it to our validation data set to see if the performance was similar between the training and the development, or in the validation data sets. And we found that the results were actually fairly similar between the two. So the 6 factors that we found that to be prognostic included neutrophils lymphocyte ratio, ECOG performance status, LDH, anemia, liver metastases, and platelet count. All the checkpoint inhibitors so far have been shown they're improving survival for patients with advanced urothelial cancer, and that's a great outcome for all patients. But again, trying to identify which are the risk factors, which are the important outcomes, or which factors define which patients will do much better and which patients maybe will do not so well, and therefore should be treated with a different therapy. That's a key factor in our results.